Hello, everybody. It's March the 10th. Time for another Chuck Chat. Always like to start off with a little humor, so here goes. Best thing about March, you never know when a free lawn chair will blow by. Allergies, because nature kind of hates you. Sometimes I feel that way. Spring is here. Time to blind everyone with your pasty winter legs. Look, it's the first orange barrels of spring. There is a lot of road construction going on right now. Nothing says spring like a bird crap all over your car. I'm in the mood to do some spring cleaning. Apparently cabin fever has made me delirious. COVID-19 in Westminster, our numbers have stayed the same. We have no active cases at this time for residents or associates. We continue to do some testing weekly in healthcare and as needed. So folks that travel or have trips to the emergency room, et cetera. Our infection rate continues to be very low. Texas is doing better, continues to trend down the last few days, so that's a good sign. Cumulative cases, we're about 2.7 million now, total cases since this all began in Texas. We are the highest state in the union. Phase 2 reopening, we are in the middle of for Westminster. That means staff resident-led activities increased to 20 or less. We'll have some limited indoor activities for up to 30 in Harrisville Hall with sign-up sheets, social distancing and mask, and up to 50 for outdoor activities with social distancing and mask. And these numbers will increase over the next couple weeks. Hopefully by April, we'll be at 50 to 70 in Harrisville Hall with sign-up sheets and social distancing. Laurel Dining Room remains at reduced capacity, 25%, and that will happen until March the 15th. And March the 15th will be at 50% capacity. Visitations increased up to 2 visitors per visit, 1 hour, designated locations, and by appointment only, 8 a.m. to 4 p.m. Limited service providers are allowed in independent living residence appointments with appointments set through resident services office, no more than twice per month right now. And we hope to increase that in April as well. Grab and go continental breakfast as well as breakfast menu in Laurel Dining Room is available, and also still room delivery. Health center visitation guidelines have improved, so we are allowed to do outdoor visitation with a scheduled appointment through Jamila at the Westminster Healthcare Center, the Arbor. Just give her a call, or you can email her to set up an appointment. Each appointment lasts about 45 minutes and 1 visitor at a time still. COVID vaccine, so 99, almost 100% of residents have been vaccinated. About 76% of associates have been vaccinated. We have received the coolers that we need to store the vaccine in. And so we have applied for approval to be a vaccination provider in an ongoing way. Should hear from the state soon. Once we receive that approval, we should receive doses of vaccine, and that will allow us to vaccinate more staff and residents as needed. Please wear your mask safely, like London is in the top picture. Questions and answers for March the 10th. What freedoms can we expect to have at Westminster after we receive the vaccine? Those will continue to increase. The vaccine is most effective after 14 days from the second dose is received. So everybody at this point, almost everyone at this point is protected, but we have a few residents that received their vaccination on the 1st of March. So we'll need to wait until mid-March, which is the 15th. That's one of the reasons we are increasing capacity on the 15th. So more of our residents and staff have been vaccinated more than 14 days. We will increase the dining room capacities and activities capacities over the next few weeks, and we will continue to slowly and methodically reopen. Second question, could we please have a rowing machine included as an exercise option in the new fitness area? I I have no problem with that. I'll pass the recommendation on to the consultants on the expansion as well as our own wellness associates for consideration. Can we get an update on the pool, please? The pool should be open this week, hopefully, or early next week. We have a little bit of warranty work they're going to be doing on the liner, and then they are installing those vent covers this week as well. When will the temporary copy machine in the library be replaced with a machine that has as many options as the last one did? This machine has been ordered and should be replaced this week or early next week. As soon as it arrives, we'll replace it. Next question, why are banquettes being considered as a seating option for a dining area in a facility that includes people with mobility limitations? The banquettes in the design are custom designed senior-friendly banquettes designed by a senior living designer and have been used successfully at other communities. There will be just a few of them in the new dining room, but they look really nice and they are senior-friendly. And they're not going to be huge banquettes. They're going to be basically four seats, 2 per banquette. So they're pretty easy to slide into. Can you explain what is going on with the Preston corridors and lobby? Yes, we're finishing up the lobby. So we're installing the new vinyl tile that's supposed to be replacing the gray tile that's in there. It has more of a goldish, tannish tone to it with the gray. And we are skim coating all the walls in the Preston, replacing the handrails on the entire building and painting. There is a sample near apartment 433. The difference will be that we're going to stain the handrails instead of painting them. And this was a beta test. We're just trying it out to try and figure out what we wanted to do. We had a blue door there originally, and I think we've decided to go with this color scheme. So have a look if you like, or you can look at the picture in this slide. I've had the vaccine, now what? Please continue to be cautious when out in public. Please continue to wear your mask, limit trips, continue to wear your mask when outside of your apartment home or when receiving services in your home, limit exposure to large groups, limit your travel, practice good hand hygiene. Please continue to follow all Westminster precautions and restrictions. Construction update, we're making a lot of progress. You can see they're pouring the second level of the Carlisle building parking garage, and they're also pouring columns. This will increase speed over the next few weeks, but it should be each week they'll be pouring different sections of concrete for this parking garage, and then eventually all levels. You can see the post tension cables being placed right here. The infill building is also making progress. We have had to delay a concrete pour. It was supposed to happen today. It will happen tomorrow. It has to start at 6 a.m. in the morning, unfortunately. So I'm sorry for that disruption, but it's a 30-inch thick slab that has to be poured at that location. So you can imagine how much concrete has to be pumped into the area, and it has to be finished. And so it's going to take from 6 a.m. to about 8 p.m., 9 p.m. at night to finish that concrete slab. So I'm sorry for the inconvenience, but they will be starting at 6 a.m. tomorrow. I included this schedule. I'm not going to go over it in detail, but we'll try to pass it along to you in the summary. You can see that we're working on the exterior basement walls as well, and then doing the concrete pours. Level 2 we're doing right now. Level 1 pour should be happening around the 15th of March, so next week. And that's actually coming up out of the ground. You can see here also that they're backfilling the garage walls, so preparing the connections between the new parking garage section and the old parking garage. And then we're working also on sheetrock and taping and floating painting walls on the bridge. Bridge number 2 work is ongoing, have almost completed it. They have opened up the wall on both sides of this bridge, and the Windsor Courtyard continues to be worked on. The plan is to complete that in May. Outdoor kitchen water features drain work is underway as well. Pergolas to be installed. I think they're already starting to do that. Healthy Options Cafe extension is making good progress. You can see where the walls for it are starting to be finished up. Pouring concrete on all levels like we talked about, and the drive between the Windsor and the Preston is now open and will remain open. So you should have no reason to go north of that driveway. Don't go north by the west side of the Windsor. If you can avoid it, please do. It's very congested up there with construction traffic. Overall site plans, rendering, community update. So just another update from Culinary Services. Again, the Laurel Dining Room is open at 25%. Starting March the 15th, will increase to 50%. The Grab and Go Continental Breakfast is available for pickup in the Laurel Dining Room and the game room from 7 to 9:30. The Laurel is open for all 3 meals, including serving a breakfast menu, until 1 p.m. each day. The Laurel Dining Room will open at 7 a.m. until 8 p.m. with the last seating at 7 p.m. Reservations are required for dinner only after March the 15th. So it should be okay to come to lunch after March the 15th without reservations. Reservations will be required for dinner though, because it's very busy typically. Solar film underway on some apartment interiors. We're about halfway finished with that project. We are finished with the window seals, so that part's done. Preston flooring replacement has been completed on the 5th, 4th, 3rd, 2nd floor. And the first and ground will be completed by March the 22nd. 4th floor laundry room, this project will be completed by March the 22nd. The appliances are in and they'll be installed this week and they'll be tested. Boilers repaired on the Preston. The boiler serving Sea Wing is still a temporary boiler, so that will be replaced soon. The water softening for the entire campus will be installed. The installation will be complete on March the 11th, and it'll start operating on March the 12th. So you will notice that your hot water especially is softer than it was before. Improved hot water control to be completed in March, and a large hot water recirculation pump on the Windsor has been installed. 2021 achievements, I'm not going to go over this, but we've had a pretty good start to the year. We just recently received word that Robin Akins, our resident health and wellness director, has been awarded the Emerging Leader Award through Leading Age Texas. So if you see Robin, congratulate her for her well-deserved award from Leading Age Texas. Just to mention again, star cards can be used for any associate, including those in management and supervisor positions. Star cards can be turned in at any reception desk or to any member of management. You can also just write a note or an email, and those are passed on to the associates as well. Reopening strategy continues to be slow and deliberate, and continuing to reopen in phases to ensure good and consistent systems are in place to support all we serve. Please continue to follow Westminster's instructions with regard to precautions and restrictions. Our precautions are designed to allow as much protection of our residents and associates as possible while increasing flexibility and getting us back to normal safely. Sometimes you'll be disappointed because what you hear on the news is not necessarily what's happening here at Westminster. Sometimes our precautions and restrictions may be more than the new recommendation coming out on the news. We will confirm every change in directives with the state, the CDC, local authorities, and our management company before we move forward. It is important that changes are communicated well across the campus and support is available at each phase of reopening. Resident associate safety is our primary concern and has been. Thank you for your continued cooperation. Your cooperation over the last year has saved lives. It's been a year tomorrow that this actually yesterday, that this all started. So I appreciate your cooperation. I know that everyone's getting cabin fever and wants to get back to normal, but we need to do so safely. So you may have heard on the news, there's been some changes to the CDC's recommendations, and they talk about gathering indoors with fully vaccinated people without wearing masks. We're still recommending wearing masks. The thing that they're not saying is that seniors are at increased risk for severe illness from COVID. So you're still in that category that's very vulnerable. And that's one of the reasons that we're acting out of an abundance of caution and being very slow and methodical with our restrictions and precautions and reducing those slowly and methodically. So just be careful. We do live in a group setting, and you may come into contact with somebody that has not been vaccinated. And it's very important that we maintain all the precautions we can. What hasn't changed, even per the CDC, for now, you still take steps to protect yourself and others in many situations, most situations. And at Westminster, I tell you, in all situations, like wearing a mask, staying at least 6 feet apart from others, and avoiding crowds and poorly ventilated spaces. Take these precautions, however, whenever you are in public, which is anytime you're outside of your apartment, gathering with unvaccinated people from more than one household, visiting with unvaccinated person who is increased risk of severe illness. Remember, all seniors are at increased risk of severe illness from COVID. You should still delay domestic and international travel. If you do travel, you still need to follow CDC recommendations and requirements, and this includes quarantining. You should still watch out for symptoms of COVID, especially if you've been around someone who is sick. If you have symptoms, you should get tested immediately and stay home and away from others. You still need to follow guidance at our community. Remember, seniors are at increased risk of severe illness from COVID. So please continue to wear your mask when outside of your home or when receiving services in your home. This is still mandatory at Westminster. Practice good hand hygiene. Do not touch your face, eyes, or masks. Stay home except for essential trips. Limit travel and extended visits. If you're out of Westminster overnight, quarantine procedures still applies. We'll test you within 5 to 7 days. Quarantine until results are back. Usually takes 2 to 3 days to get the results back. Maintain social distance of 6 feet or more unless you're in the same household. Follow all precautions even after you receive the vaccine. All visitors to our campus, family, staff, and private caregivers must sign in and be screened before they enter the campus. Small groups must still wear masks for the time being. Thank you all for making Westminster an extraordinary place to live and work. Appreciate your cooperation. I know we all want to get back to normal, but let's do it slowly, and methodically, and cautiously. Thank you very much for your attention. Stay strong, stay healthy. Thank you. Bye. Till next time.